YMCA education series is free and open to the public, so we encourage you to spread the word and invite family and friends to participate. We host approximately 8 to 10 different topics each month, and these are various subjects. This program will last about an hour, and you might find that you have questions during this presentation, but we ask that you please wait until the end of the presentation to address them. When you have a question for the speakers, simply type it in the chat section on your screen, and I will relay that question to Rosemary. You may also raise your hand and ask a question yourself if the chat is not working for you. I ask that you please keep your questions general, and we will do our very best to address them all in the time allotted today. Thank you again for joining us this morning. And now I would like to introduce you to Rosemary Gerstner. Rosemary is with Senior Helpers. She's been there for over 4 years as a sales and marketing director. And Rosemary has had firsthand experience caring for her grandparent and great uncle. And she is passionate about bringing the education about Parkinson's to the community. So I'm going to turn off my camera and leave the floor to Rosemary.
Thank you, Anna. I'm going to go ahead and share my screen. Good morning to you all. Thank you for having me today. Today, we are going to be talking about Parkinson's disease. I have a special interest in Parkinson's disease because over the years that I've worked with older adults, I've seen several chronic conditions get a lot of attention, including Alzheimer's, dementia, cancer, but I haven't seen Parkinson's get as much attention as I think it deserves, especially considering how pervasive it is. So it's my goal to give you an understanding of what it is, but I think more importantly, the best ways to combat the disease and the best lifestyle changes to implement to have the highest quality of life possible. Today, we have a few learning objectives. I'm going to give an overview of Parkinson's disease. I'm going to discuss the most common risk factors for people living with the disease. And we're going to discuss some solutions for those common risk factors. And finally, I'm going to talk about creating a patient-centered management plan for Parkinson's disease. And patient-centered management of chronic conditions is really the gold standard of managing chronic conditions now. And I'll show you sort of what that might look like for someone with Parkinson's disease. So what is Parkinson's disease? Parkinson's is chronic, meaning it's recurring. It is it's recurring, it's persistent, like asthma or diabetes. It is complex. Parkinson's disease has many, many different symptoms, and it is progressive. There is a gradual worsening or advancement of the disease. Parkinson's is the second most common neurodegenerative disease. The first is Alzheimer's. And presently, we don't know exactly what the cause is, and presently, there is no cure. Parkinson's affects about 1 million Americans. That number goes up every year. About 60,000 Americans are diagnosed each year. There are about 10 million people worldwide who have Parkinson's disease. It's present in all races and socioeconomic groups. There does seem to be a slightly higher incidence of Parkinson's disease in men than women. The average onset of diagnosis is the average onset of the disease is 55 to 65 years of age, which is 5 to 7 years before it's usually diagnosed. That diagnosis age is on average 62 years old. There's a small percentage of people who are diagnosed with Parkinson's disease who are under the age of 50. and it impacts about 1 out of every 100 Americans over the age of 60. And so it means it's fairly common. And like I said, it's becoming more, and we see it more and more in the population, which tells me that doctors are really getting better at diagnosing it early on. Let's talk about the pathophysiology of Parkinson's disease. That means what's going on in the brain. When someone has Parkinson's disease, there is a gradual loss of cells in what's called the substantia nigra. The cells that are lost are the ones that produce dopamine. And dopamine is the chemical messenger that transmits signals in the brain to coordinate activity. When you have fewer of these cells in the brain, it means that you have less dopamine. At the time of diagnosis of Parkinson's disease, about 50 to 70% of an individual's dopamine cells have been depleted. So what does that mean? Well, I liken it to the United States Postal Service. You have less dopamine, just like we have fewer postal workers, which means that our mail is arriving very slowly or not at all. That's sort of what's going on in the brain. Those messages they're either getting transmitted very slowly or not getting transmitted at all. But there is hope. Parkinson's medications are meant to replace the dopamine in the brain, and they are very effective at managing the movement symptoms of the disease. So if you're familiar with Parkinson's disease, you may recognize the names of some of these medications. Individuals can live well over 30 years after diagnosis of Parkinson's disease and should expect a full normal life expectancy. And there are advances in Parkinson's research every day. Importantly, the Michael J. Fox Foundation and the Parkinson's Foundation are both two huge, well-funded, prominent foundations whose sole purpose is finding a cure for this disease. So when we think about Parkinson's, I think it's useful to think about the word move. There are movement symptoms for Parkinson's disease. Those are the most well-known. But then there are other non-motor symptoms, and these tend to be the ones that aren't as well known and can be most problematic for people. It varies from one individual to the next. There's a saying, you've seen one person with Parkinson's disease, you've seen one person with Parkinson's disease. It does not look the same in any two people. And finally, there's an evolution or a gradual worsening with Parkinson's disease. An individual with a diagnosis of Parkinson's disease will see a decline over time. So there are cardinal symptoms of Parkinson's disease, and these are the symptoms that are used to make a diagnosis. And those cardinal symptoms are tremor, rigidity, bradykinesia, which is slow movement, and postural instability, which is impaired balance. Now, to receive a diagnosis of Parkinson's disease, an individual must have experienced two of the three symptoms that are above the line. So here's the line. And to get a diagnosis of Parkinson's disease, an individual must have rigidity and bradykinesia, or tremor and rigidity, or tremor and bradykinesia. And I like to point out that often Parkinson's is thought of a disease about tremors, but as you can see, you need not have tremors in order to be diagnosed with Parkinson's disease. The fourth cardinal symptom, postural instability or impaired balance, is usually a late stage symptom in the disease. If someone is experiencing impaired balance earlier in the disease, it may not be true Parkinson's disease. It's likely a Parkinsonism, which is similar to Parkinson's, but it's a different pathology altogether. There are some other movement symptoms which you may be familiar with, including fascination, that's a quickening of steps, freezing of gait, most people know about, dyskinesia, which is excessive movement, and dystonia, which is an extended muscular contracture. Now, there are several non-motor symptoms. In fact, there are more non-motor symptoms than they are motor symptoms. The non-motor symptoms are those that do not affect movement, coordination, or mobility. These two vary greatly from person to person. And most importantly, research shows us that the non-motor symptoms are the ones that really impact quality of life, particularly because Parkinson's medication, as I mentioned, is very good at treating the movement symptoms, but the availability of medication and the research for medication to treat the non-motor symptoms just isn't there yet. The research is in progress and they're discovering new things every day to help treat those non-motor symptoms, but the medication just isn't at the level that the motor medication is. So this is, I'd say, an admittedly overwhelming list of some of the non-motor symptoms that come along with Parkinson's disease. I've highlighted some of the non-motor symptoms that we see most commonly, including urinary urgency, low blood pressure, depression. Speech difficulties are very, very common. Bradyphrenia, slowness of thinking. All of these are symptoms that people don't often think about with Parkinson's disease, but that we see commonly, and they have a huge impact on quality of life. How is Parkinson's disease treated? Well, I've mentioned medications. Medications, that's number one. They do a great job of managing the disease. At late stages, surgeries can be a good option. Exercise, as important as medication. I'll say it again and again and again in the presentation. Medication timing and exercise are your
talking about Parkinson.
Are your number one and your number two best options for treating the disease. Therapies are very important. Physical, occupational, speech therapy is hugely important, but also important. And these are the everything: medication, surgery, exercise, therapies. Those tend to be some clinical options that will be recommended by your neurologist, your primary care. We also want to talk about what are called social determinants of managing the disease. And that means identifying and resolving someone's risk factors and creating, again, that patient-centered management plan that I spoke about earlier. So we're going to identify and dive into some of those risk factors. So the risk factors for Parkinson's disease, and I don't mean risk factors that would be the things that predetermine that you would have Parkinson's disease. I mean, as someone living with Parkinson's disease, what are the risk factors that threaten having your best quality of life? And we can split those into three categories: disease-related, environmental, and behavioral or lifestyle risk factors. First, disease-related risk factors. Parkinson's is classified as a movement disorder, so it follows that a number of those risk factors are related to mobility, poor balance or gait, freezing, postural difficulties, low blood pressure, vision changes. All of these are risk factors that can lead to falls and overall poor quality of life. And as we know, any fall can be a catastrophic event, which can lead to extended hospitalization and trigger an irreversible decline, or at the very least, change the trajectory of your aging in place process. So what are some disease-related solutions? Medication timing is a huge, huge part. With Parkinson's disease, it is absolutely essential that Parkinson's medications are taken at the same time every day. Usually, and there will be more and more medication added as the disease progresses. Some of our clients start out their Parkinson's journey with having one or two medications, maybe one at 6 a.m. and 6 p.m. Some of our Parkinson's patients in later stages are taking their medication every 3 hours, 6 a.m., 9 a.m., 12 p.m., etc. And it is essential those medications are taken at the same time every single day. Exercise. Again, exercise. Parkinson's, if you remember one thing from this presentation, remember that Parkinson's is a movement disorder that is battled by movement. The more you move, the better your symptoms are going to be, the less risk you will have for falls. Fall monitoring and balance testing. There are several doctors' offices, therapy offices and even some senior living facilities that will offer fall monitoring or that will offer balance testing to identify fall risks, but also, the devices that you can wear around your neck, the purse devices, those are huge because someone with Parkinson's disease is most likely at some point going to fall, and they will need rapid assistance as soon as they do. Nutrition assistance. This is an evolving area of treating Parkinson's. I work with a nutritionist who has a program that is designed to really address some of the nutrients lacking in the diets of those with Parkinson's disease. Access to providers, being able to get to your neurologist, being able to get to your doctor at those regular intervals. People with Parkinson's have many, many appointments, and they need to keep those appointments because those appointments are what are determining what medications they should be on. And of course, access to higher levels of care. Parkinson's is a chronic, persistent disease, which is going to evolve. And at some point, you're going to need a higher level of care. Next are environmental risk factors. Environmental risk factors are those that are in the immediate environment of our house, our apartment, wherever we live. For Parkinson's disease, the environmental risk factors that are the most problematic are those that, again, lead to falls. I like this image here of this box of postcards because to me, this doesn't look like clutter. This looks like a beautiful box of memories, very special memories. And my point here is that when you're decluttering or downsizing, it's not that you can't keep the things that matter to you. It's that you should be able to get rid of the things that don't matter to you, because we do often see that clutter around the house that builds up after decades of being there can create a compromised living environment. Some of those risk factors besides clutter are stairs. Stairs for a person with stairs are an environmental risk factor for somebody with Parkinson's disease. At some point in the disease, they will likely not be able to use stairs. Poor lighting, uneven floors, small spaces can be very difficult to navigate, especially for someone with Parkinson's who's using a walker. Improper footwear and slippery surfaces. And these are, of course, environmental risk factors for anybody, right? It doesn't just have to be someone with Parkinson's disease. These are risks for anybody. So what are some solutions? Decluttering and downsizing, getting rid of some of those things that you don't need anymore, you don't want, having an intentional process to keep the things that you treasure and to get rid of the things that you don't. Regular safety assessments, bringing in a professional to identify some of those safety risks that you might not see, but that the professional will have seen them over and over again and can spot them immediately. Having an accessible home environment, whether that means, adding some rails outside, grab bars in the bathroom, maybe a chairlift to go up the stairs, to make that living environment accessible so that it's not dangerous. And, higher levels of care. A lot of people with Parkinson's move into continuing care communities. So because they know the trajectory of the disease does mean that at some point they'll need a higher level of care. And I always have to say, get rid of those area rugs. I love my rugs too, but they can really be a tripping nightmare. If you want to keep them, there are ways to have them professionally secured down, but I would recommend that you do it professionally. Next, behavioral or lifestyle risk factors. So many of these behavioral risk factors are in fact disease-related risk factors. Inactivity, impulsivity, anxiety, those can all be non-motor symptoms of Parkinson's disease, like we talked about before. Depression can be a non-motor symptom of Parkinson's disease. These are symptoms of the disease itself, although often they're not looked at it that way. People think, oh, why isn't, Betty showing up to our normal exercise class? Oh, she's being lazy. No, she might be having a non-motor symptom of Parkinson's disease that is causing periods of inactivity for her. These are the kind of Parkinson's symptoms that really impact quality of life. And most Parkinson's research right now is completely devoted to figuring out how to alleviate these symptoms, because again, these truly cause poor quality of life for those with Parkinson's disease. What are some solutions? Because exercise is such a huge, huge part of battling those motor symptoms, you want to make sure that you have easy access to that daily exercise program and someone to motivate you to stick with it. Again, if you're having a moment of inactivity or depression due to Parkinson's disease, you want a buddy who's going to be there to either motivate you to come with them to the exercise class, or at least maybe to report to a family member or your neurologist, hey, I think there's something going on with Betty because she really needs to be exercising. It's a huge part of her Parkinson's treatment, but she hasn't exercised all week. And I think there might be something else going on. Medication reminders. If you're having a bout of executive dysfunction due to Parkinson's disease, you might forget to take your medication. And that is going to spiral into not being able to control your movement symptoms. Therefore, using a medication timer, they make medication boxes that have timers on them. So they will bing you at the time that you have to take your medication. That way, if you're having a bout of executive dysfunction, even if you were to forget, the timer is reminding you. Fall prevention and monitoring, again, a huge, huge lifestyle solution to living successfully with your Parkinson's disease. Easy access to your neurologist, physical therapist, occupational therapist, speech therapist. You want to make things as easy as possible for yourself. So if you're having, a blue day, right, with Parkinson's disease, many people do have those blue days. You won't, you'll have that easy access. It won't be one more, obstacle to getting to your neurologist. And community, being a part of a community, whether it's the North Suburban YMCA, whether it's your church community, that's a huge part of living successfully with Parkinson's disease. You want people to understand that you are somebody who has a chronic diagnosis, are taking all of the steps that you need to take, but also people who are going to really rally around you if they see something that's a little bit off. Maybe they can do, like I mentioned before, do some of that reporting or feedback for you. Finally, I just want to emphasize again that exercise is medicine. Give me one step and take a sip. Exercise. Research has shown that exercise can improve gait, balance, tremors, flexibility, grip strength, and motor coordination. Engaging in any level of physical activity is beneficial. So whether if you're doing nothing, do it 1 day a week. If you're doing 1 day a week, do 2 or 3 days a week. Movement is hugely important to battling this disease. As I mentioned at the beginning of the presentation, the best approach to Parkinson's disease is to try to create a patient-centered management plan. So I'm going to read that. What does that mean? Individualized therapy involves not only the pharmacological and surgical management, but also the appropriate use of allied health professionals, assistive technologies, educational and support resources along the chronic illness continuum. So what does this mean? This means that for every person who has Parkinson's disease, we need to build a team around them. What does this team look like and how do you assemble it? So I've been doing this for a while and I've sort of been able to create this universe of providers who I think really are essential to someone having the best quality of life while they live with Parkinson's disease. And I do believe that this is the universe of allied professionals who could be on someone's team. Now, not all people with Parkinson's disease might need all of these people. But most people with Parkinson's, all people with Parkinson's disease need some of these people. All people with Parkinson's disease need a neurologist. All people with Parkinson's disease need an exercise program. They're eventually probably going to need care coordination. They may need a caregiver at some point. They may need support groups. They may need a nurse practitioner. So this is, and there are many people with Parkinson's disease who do have most of the people in this universe somehow playing a role on their team. The important thing is that you make the management plan unique to you. So for this person, for example, they have, as I talked about before, the medication timer on their medications so that they're getting that automatic timer every day and they're remembering to take their medication on time. They, of course, have their neurologist. They, of course, have their daily customized exercise plan. They're part of a Parkinson's support group so that they can meet with others who are living with the disease. They've made their home environment accessible by adding, rails to come into the house, by adding grab bars in the bathroom. They are in speech therapy because they've had some swallowing issues, which is very common with Parkinson's disease. And they participate in their church choir because it's something they love to do, and it helps strengthen their vocal cords. So their speech therapist loves that. They're also in dance or movement therapy. Dance and movement therapy, they've always enjoyed dancing, and they've realized that dance and movement therapy is another great movement way to battle the Parkinson's disease with movement. And of course, finally, they have their family and friends. Whatever your family or friend support group is, your community, is a huge part of helping you manage a chronic disease. I want to share with you some resources here. Parkinson's Foundation is an amazing resource. This number, the Foundation helpline, you can call that helpline Monday through Friday, 9 a.m. to 5 p.m., and a nurse picks up. Let's say somebody is in an episode, a freezing episode, and they just can't get unfrozen. You could call the Foundation helpline and a nurse will pick up and give you some tips, and it's all for free. The Michael J. Fox Foundation for Parkinson's Research, amazing, amazing work. I do believe that the Michael J. Fox Foundation is going to find a cure for Parkinson's disease. Senior Helpers of Greater Chicago, our business is to provide caregivers for those who need companion care all the way up to skilled care. But we have a lot of great Parkinson's resources, which we are happy to share with anybody. And in fact, I founded PARC, the Parkinson's Allied Resources Coalition. We are a group of businesses, which includes exercise, nutrition, speech therapy, music therapy, dance therapy. We have an estate planning attorney. We have a financial planner. We are a team for you that's in place should you need any of us. And we are committed to helping those with Parkinson's try to live their best quality of life. I am going to drop them off at the North Shore YMCA for anybody to pick up. But as I mentioned, at Senior Helpers, we have a lot of really great tools for Parkinson's disease. This is one of them. This is our Parkinson's Care Program Strategies for Care Wheel. Now, what it is you point the arrow to a symptom. So let's say somebody is struggling with, we'll choose tremor, okay? You would point the arrow to the symptom, and then down here in the window, it gives you characteristics and strategies and techniques. So for example, with tremor, the characteristics of a resting tremor are a rhythmic, involuntary shaking or quivering movement. The symptoms of an action tremor are a shakiness while doing an activity like holding a coffee cup. Strategies and techniques include weighted utensils or a vibrating pen, to use cups with lids and not fill a cup to the top, to use both hands, both the tremulous hand and the non-tremor hand, and to cut food before coming to the table. So I'm going to drop a bunch of these wheels off at the North Shore YMCA. So those are available to any of you who are on the presentation today. That's all I have. Does anybody have any questions?
So if you have any questions, please unmute yourself, or you can also type it in chat. And I know sometimes questions come up a few minutes later, just when it's over, you think of something.
Patricia, did anything I was saying seem familiar from your experience with Parkinson's? Oh, unmute yourself.
Yes, especially the dimension at the end.
Yeah, yeah. Very common non-motor symptom.
Right.
Mm-hmm. Parkinson's looks like a lot of things, and it changes as the disease moves on.
Right. Yeah, we were very active. We bicycled all over Europe, Scandinavia, 600 miles in Botswana, Africa.
Wow.
Scuba diving 35 years from the Red Sea to Great Barrier Reef, ran into Jacques Cousteau.
Oh my gosh.
We've supported the Habitat for Humanity, and they build in 80 different countries, and we've been to Romania and Nicaragua, and we've been on a couple of Jimmy Carter builds. Wow. So it was a big change in lifestyle.
Huge change. Did he stay active after the diagnosis?
No, like bicycling ended when he fell one time.
Yeah. Yeah. And it's, it's good to be able to do the thing, that you enjoy as long as you can. But there are other, ways to modify after that. We have one of the ladies in my group, her name's Laura Slowey, and she does in-home training. And she's good at, really modifying exercise programs to meet people where they are. But, sometimes when you fall off a bicycle and you've been biking your whole life, it's traumatic. You feel like, that's, I'm sure that felt like a personal defeat for him.
Yeah, right.
Yeah.
But I'm eternally grateful. We had almost 60 years of marriage. A lot of people don't even have that.
Not even half of that for a lot of people. That's amazing.
Well, does anyone have any more questions for Rosemary? Thank you.
Thank you for having me. Like I said, Anna, and I'll connect with you about dropping some of these off for anybody who wants one, who is on the call. If you have somebody with Parkinson's, give it to them. These wheels can be a lifesaver, literally. And we're happy to share the resource with anybody.
Thank you so much, Rosemary. This concludes our YMCA Education Series presentation. On behalf of the North Suburban YMCA and our Yes Series, we thank you for supporting our organization and programs like these. A special thank you to Rosemary Gerstner for speaking with us today. Programs like this one are free and open to everyone in the community. So if you enjoyed today's program and would like to support the North Suburban YMCA, please consider helping with a donation at nsymca.org. We hope to see you at our next speaker series on Tuesday, July 28th at 7 p.m. And the subject is Heal Pain and Beyond. Thank you again and have a great day.